Welcome back to Pick Your Poison. I'm your host, Sarah Smith, and today we have some very special guests joining us to discuss Oxbryta, a drug for the treatment of sickle cell disease. Welcome, Dr. Palmer and Dr. Barton.
Thank you. It's great to be here today.
Today we are talking about the origin and development of Oxbryta, its intended medical use, the drug's biochemical and physiological effects, and highlight key clinical studies. Then we will wrap up by noting ongoing research and the drug's future prospects. So, Dr. Barton, who developed Oxbryta and what is its intended medical use?
Oxbryta is a uniquely developed drug which was made for the treatment of sickle cell disease in patients over the age of 4 years. Developed by a company called Global Blood Therapeutics, Oxbryta's intended medical use was always for the treatment of sickle cell disease.
And so how does Oxbryta differ from other medications in its class?
Oxbryta is a completely novel drug as it was the first drug to ever target the primary cause and pathophysiology of sickle cell disease by blocking hemoglobin polymerization and is the only drug in its class that is found to target hemoglobin S inhibitors for the treatment of sickle cell disease.
Thank you, Dr. Barton. Now let's look further into the pharmacodynamics and the pharmacokinetics with Dr. Palmer. So, Dr. Palmer, how is Oxbryta absorbed, distributed, metabolized, and eliminated in the body?
Oxbryta is rapidly absorbed after oral administration, taking just 2 hours to reach max concentration in the plasma, approximately 6 hours in the whole blood, and 18 hours in red blood cells. In terms of distribution, the apparent volume of distribution of Oxbryta in the central compartment is 338 litres and 72.2 litres in the plasma. Oxbryta is heavily metabolized in 2 phases. Phase 1 consists of oxidation and reduction, while Phase 2 metabolism consists of glucuronidation. Oxbryta is oxidized primarily by cytochrome P450-3A4. Oxbryta is eliminated through the feces and urine, with approximately 63% through feces and 36% through urine.
And what is the mechanism of action?
Sickle disease is characterized by deoxygenated sickle hemoglobin polymerization, which leads to sickle-shaped red blood cells that are unable to effectively bind oxygen that aggregate, blocking blood vessels throughout the body. Oxbryta is a once-daily oral medication that binds reversibly to hemoglobin, causing an allosteric modification resulting in increased hemoglobin-oxygen affinity. This increased affinity stabilizes the red blood cells in an oxygenated state, blocking hemoglobin polymerization, which goes on to prevent subsequent sickling and destruction of red blood cells. Studies suggest that reduced red blood cell sickling improves red blood cell malformation and extends the half-life, which decreases blood viscosity, hemolysis, and anemia.
What are the biochemical and physiological effects of Oxbryta?
Effects of the drug include increased oxygen affinity, reduction in hemolysis, improved rheological properties, as well as reduction in symptoms and complications associated with sickle cell disease, such as pain, organ damage, and reduced quality of life.
We will now move back to Dr. Barton to ask about the clinical studies and trials that have been done on Oxbryta.
Oxbryta was approved by the FDA based on evidence from a clinical trial that enrolled patients with sickle cell disease. In this trial, patients aged 12 to 65 were required to have a history of 1 to 10 vaso-occlusive crisis events in the previous 12 months and low hemoglobin levels 5.5 to 10.5 grams per deciliter. Patients were randomly and double-blindingly assigned to receive either once-daily oral Oxbryta, 1,500 mg, 900 mg, or placebo for 6 months. The benefit of Oxbryta in comparison to placebo was assessed by a percentage of patients who achieved an increase in hemoglobin levels over a 6-month period. 51% of patients treated with Oxbryta achieved an increase in hemoglobin level in comparison to 6.5% of patients treated with placebo.
Did the study show any potential side effects of the drug?
Overall, Oxbryta demonstrated a favourable safety profile, with the most common side effects being mild to moderate headache and diarrhoea, abdominal pain, nausea, fatigue, rash, and fever.
What challenges were faced during the development of Oxbryta?
Well, Sarah, developing a novel treatment like Oxbryta comes with its own set of challenges. Some of these include optimising the dosing regime, ensuring its effectiveness across different patient populations, and addressing any potential long-term effects or safety concerns.
Now, to wrap up, Dr. Palmer, where is future research focused?
Future directions of research surrounding Oxbryta is focused on impacts to paediatric patients and long-term effects to the overall population. Research is focused on understanding the experiences people are having whilst using Oxbryta.
EPT is currently studying the effect of Oxbryta using a transcranial Doppler ultrasound, measuring velocity of blood flow through the brain, focusing on its ability to decrease stroke in children. Results haven't been confirmed. Further research is fundamental for continued use of Oxbryta, could be crucial in improving patient experience by reducing the likelihood of adverse effects. It's only recently approved, meaning there's little research regarding long-term impacts of the treatment. Other areas of potential research include treatment in people under 4 years old and different administration methods to increase accessibility.
Wow, so the future sounds promising for Oxbryta. I sure know what poison I'd be picking if I was diagnosed with sickle cell and over the age of 4, of course. That's all we've got for this week's episode. See you all next week on Pick Your Poison.
This episode was proudly sponsored by the Campus Pharmacy Wollongong.